We're revisiting a smart medicine look at the risks faced by younger athletes. Hardworking young people are spending more time than ever on the court or on area playing fields, but increasingly, they're also spending more time in emergency rooms. As Doug Johnson found out, kids often play sports as intensely as adults, an intensity that can lead to injuries.
For serious athletes, the work never stops, even when those athletes are still technically children. In the off-season, Collierville High School baseball player Brad Milligan is happy to be able to work on his swing. There was doubt whether he'd be able to play after he injured his back during a medicine ball drill.
And for a few weeks after that, I was real sore in my lower back. And then when I went to hit one day with my hitting coach, I just kind of felt a little tweak back there, and I finished up and everything and didn't think anything of it. And then when I got back to my house and got out of the car, I just took one step and there was a sharp shooting pain and I just collapsed.
Brad suffered a stress fracture, often described as a small crack in a weight-bearing bone. After going through 3 months of doctor-ordered inactivity, he started working on his comeback, doing physical therapy at Baptist Hospital's facility inside the Collierville Community Center. Physical therapists like Monica Baker say highly repetitive activities can be a particular problem for younger athletes.
Sports injuries are becoming the #1 cause of emergency room visits in an adolescent. So they are much more on a rise in the last 5 or 6 years. It has really increased. You're seeing kids at a younger age play more competitive sports, be it baseball, soccer, basketball, even football.
All athletes risk getting hurt, but studies show young athletes face higher risks. Their bodies are still growing and changing, and often the intensity and length of their sports seasons can tempt some of them to try and play through their pain. Pain is a signal to let you know that something's wrong. Ignore it or try to play through it, and it will get worse, maybe even become permanent. The correct response to the signal is to get help. Baker says proper rehabilitation can be a challenge for younger athletes, so she uses examples of successful athletes she's worked with, like former Memphis shortstop Brent Lugash, now in the Detroit Tigers organization, or former U of M football players Scott Vogel and current pro D'Angelo Williams, to get kids to follow through on their work. Doctors recommend that younger players take time, 1 or 2 days a week and up to a couple of months a year, away from their main sports. This time and distance should give developing bodies the chance to rest and recover. Brad took the advice to heart and is looking forward to varsity baseball next year. But stepping back from a sport can be a tough trade-off for athletes trying to stay competitive.
About every second of the entire injury, I wanted to get it out of the way and just jump right back in. I didn't want to stretch. I didn't want to do any of the movements or exercises. I just wanted to start hitting and start fielding and throwing and playing. And because I'd never had to go through such a long-term thing, and it was tough to work through.
Brad and many of his teammates do go through other types of conditioning during the off-season to stay fit. Several of them even play other sports, though that's one way to avoid repetitive motions that can lead to injury. It's a good idea for coaches and parents to make sure that students don't overdo things.
Their bodies are still growing, so they're not a little athlete, like a little adult athlete. Their bodies are totally different than an adult playing a sport. Their bones are still growing. The ligaments aren't as taut and sealed in as well as they will be when they're an adult. So there's a lot of room for injury, especially at the joints, especially to the bones, and as well as to the muscles and tendons, because they have not finished growing yet.
Keeping an eye on how an athlete feels can go a long way toward avoiding both temporary and possibly permanent injuries, and making sure sports stay fun instead of something that leads back to rehab. For Smart Medicine, I'm Doug Johnson.